Hello, everybody, and welcome to this edition Beyond the Surface podcast. I'm really excited. Today, we're going to talk about some technology in healthcare that's a really important tool and a second step following cleaning. UV has definitely entered the market in a big way over the last 10 years. Research is showing that there are significant benefits along with some challenges. And today I would like to welcome Peter Gordon of UV for Good. Welcome, Peter. Tell us a little bit about yourself.
Good to be here today. Thank you for hosting this very important and timely podcast, and for the invitation to introduce UV for Good and how I fit into that non-for-profit. So let me talk a little bit about UV for Good first, and then what my role is, and then sort of my background and how that will inform our audience today. Okay.
Sounds
So
good.
UV for Good is a trusted US-based 501c3 nonprofit organization committed to informing stakeholders in hospitals, schools, and food production facilities about photonic disinfection best practices so users fully appreciate, better understand, and confidently apply UV technology. So that's our standard NGO language that we use. And I'll come back to that in a little bit. And how do I fit in? We're about 4 or 5 active volunteers. All of us have a long history in the UV industry or photonic disinfection industry. We've been professors, we've been government researchers, we run standards organizations, we've been product managers and marketing folks and suppliers. So we have a pretty good broad understanding of the technology, as you've indicated. How it gets used as a tool. We'll talk a little bit about its capabilities and some of its limitations still, and sort of how people actually use it effectively, right? And ultimately, it's about education and training. So that introduces sort of my part of UV for Good. I actually come from the UVC LED part of the business. So these are the little LEDs, just like lighting LEDs, but they're made to actually provide this UV germicidal light. And the education part, just a side story for a second, I actually am an elected Board of Education member in my hometown, and I drive STEM education for the young learners. So they said, Pete, you're involved in education, you're involved in UV. Maybe you can really assist in this effort to communicate all best practices and how the user base gets the most out of this tool.
Great. So you just talked about UV LED lights. There are a ton of different types of UV disinfection, different robots, different lights, everything like that. Can you give us just a foundation to work from when it comes to UV disinfection?
Oh, certainly. And I actually changed the question slightly after I introduced that. These are fundamentally well understood light bulbs. They just happen to generate light at a wavelength that we call it inactivate, but basically destroy or kill germs and infectious pathogens. And there are many different types of light bulbs. Each have their attributes and characteristics. And some work better in some scenarios and others work better in other scenarios. And it really is the responsibility of two parties. The industry really has to explain the benefits of its particular light bulbs and why they work best. Maybe they target different germs with a little better effectiveness. And then the stakeholders, the users, really have to understand what the task at hand is, right? And what job are we really trying to get done really well, really, really quickly, because time is limited, and safely, and cost effectively. So there's like a marriage of, here's the light bulb you can use for different scenarios. Here's what my scenario is and how I want to best use the light bulb. So in this case, an LED, like I said, is a tiny little emitter. It's not really used today for hospital surfaces. More the lamps that are bigger emitters are used because they have the benefit of covering hopefully the whole volume, the whole space of the room uniformly, and all the nooks and crannies. We'll get to that a bit. And then there's the user base, right? They have to make a a use and purchasing decision and an ownership decision, which is really important. And sometimes there's a little disconnect. So to understand, as you said, there's these sources, and then there's the users that really have a job to get done. There has to be some education and training. And I think that's the missing gap now. And UV for Good's trying to fill that. And today's podcast is a really good start.
So when you talk about the different bulbs and some of those things, like I said, there are so many different companies out there that are selling UV, and they're selling it in a variety of ways, some good, some bad. Um, but when a healthcare facility, for instance, comes and says, "Look, we want to try UV light," there are some things that are important to know and understand. There's a human behavior element. They have to move the lights to the right place. And typically UV is line of sight, correct?
That is correct. And we'll explore that a little bit in sort of the best use cases that we'll come up with. We have a couple ways of sort of illuminating the audience on sort of the best way of using your emitters.
So if a tell me a little bit about what they should consider. A healthcare professional
Right.
obviously isn't going to have a variety of these types of lights because they're expensive. It's an investment that they make. It is effective, I'd like to say that, but it has to be used effectively. And it also is based on the type of light that, or the bulbs, or let's talk a little bit about that. That's a confusing part for many people that are trying to make a decision.
It is confusing, and part of our role today is to sort of maybe simplify it and clarify it so people can get a good handle on some basic ways of making a tough decision here. Very expensive, but has an impactful decision. So the key is what job needs to get done, right? And UV is, I would say, is proven. I would say is more capable, right? Because when you start saying words like proven, it sort of implies, it's not like too much of a product pitch. So it's very capable, right? But it's capable within sort of its environment that it's used in, right? So the infection bridge practitioners or the environmental service workers and the folks that bring technology into hospitals have to sort of know what job they want to get done, because every room has a different configuration, and every room has its time elements of when post cleaning can happen, right? Secondary cleaning. And there's some expectation that you'll reduce disinfection pathogen load, right? Because that's the whole point, is that you don't know exactly the level of reduction, but you do know that some more reduction is helpful in some needs or some measure of that. So that's sort of the questions you ask. Like, you have this capability, and I'll focus more on the manually moved capability. So these are called towers, right? And there's towers that's singular, one tower, or there could be towers that now have satellites, which has a benefit, but it also demands a little more time and thinking and sort of understanding of where you want to put your light to get the best result. But these towers have these lamps, and some are made from mercury vapor, some are made from xenon, and there's other new ones that are coming from that different wavelengths. But let's say basically you have a wavelength that's capable. In microbiology labs, it's been proven to do a level of reduction. But now you're in the field, you're in complicated hospital rooms with all different configurations. Some are crowded, some are actually less crowded, right? But some have bathrooms, some don't. So now the responsibility is sort of, and the thinking is, I have this capability. How do I best use it, right? And is it going to be repeatable every day, right? Am I going to be able to take ownership in the sense that the job's been done well? So how do I demonstrate and assure myself, my coworkers, my peers across the hospital that the job's been done well? So these are the sort of questions that the hospital should be asking the providers. And then they should sort of be asking themselves, right? Because if they're unsatisfied with sort of that configuration of a mobile unit, maybe there's another one that sort of satisfies the need for that room. And then how do we monitor it? How do we know that the light did its job, or was supposed to do its job, day in and day out, and it's very repeatable, and it's very cross-trainable? The folks can teach each other in a sense. I got the best result using it this way in this room. and then we got the best result in that room. And let's make sure everyone sort of does similar things. Then how do we show the management of the hospital that we did this, and we assure them that yes, things are working well. And then how do we know that it doesn't have any deleterious effects on other parts of the hospital? I think we'll cover that a little bit. And then how do we know in a year from then the lamps are working and the mechanics are working, and does it need servicing and maintaining? So these are all important, I guess, purchasing decisions and then use decisions. Does it sort of help your audience sort of understand the dynamic of the lamps and the configurations and how they're used? I try to keep it at a pretty hands-on level.
Well, it doesn't, it doesn't. So
Okay.
I'm, let's pretend that I'm an infection preventionist and um, I am considering purchasing a UV disinfection device. And I know that I have a high rate of C. difficile. And obviously, we know that microbes are going to move wherever they're going to move, however they want to move. And we also know that UV lights are line of sight. And your point is well taken about the different configurations of rooms and what you need to take into consideration. So, as an infection preventionist, by no means am I a UV light expert. First question would be, where would they go to become educated so that they could make a knowledgeable choice? And is there a source for potential questions? I mean, you brought up some really great questions here just a minute ago. Is there a source that they can go to get those questions so they know what to consider when they're looking at the different products that exist now?
Yeah, that's the crux of it, right? Is there a great library of a lot of user history, and have people sort of walked, are they walking in the footsteps of prior people that have gone through this? And I can't say there's a one go-to source, and that itself is a problem, right? Because it'd be nice that it was consistent, it was well agreed upon. But at least the starting point is there is some microbiology established. So that's good, right, for the C. diff bacterium. There is some user case studies that say we were able to do some reduction of the pathogens using these type of emitters in a certain way. And then I think you have to build up your own experience. And that's where the problem is, right? Because that in itself is a huge learning curve, and it takes training and education. As I said, UV for Good is sort of trying to gap fill, but that's sort of the disconnect. How much training do you get from the suppliers? And is that training translatable, right? Or is it only they know the perfect case for their device, but it only will work, the way they want it to work, right? So I mean, it's kind of a tug and pull. How do you extract that good information? I think some of the trade shows in the industry have had good panel discussions in the past. They may have good videos to watch, or maybe they're being developed as we move forward, as the generation of emitters sort of has evolved to this one mobile tower, but other satellite towers. But in general, I think it's going to take a little trial and error to get it right. And that's the time investment up front. And hopefully the supplier base is patient, in that the user base has the bandwidth to go through this learning curve. But once I think you set some basic parameters and you can monitor that these parameters are sort of working, you're getting a C. diff where it resides, and you know that you've had some reduction, then I think the confidence level goes significantly higher, right? And people can now have done an appreciation, as I said in our mission, they got a better understanding, and then they can use this confidently. But it's still short of slam dunk, right? You have to recognize that it's I think it's just really empirical, sort of learn as you go type of technology, but it has real good capability. I mean, that's sort of unsatisfactory to me, but I think that's a realistic assessment of sort of how you would use these towers in hospital rooms.
So some of the issue is, going back to the decision-making process on what type of UV light do I need. And there are some really good salespeople out there. And oftentimes the data that they're providing a healthcare professional does not necessarily support what the healthcare professional is looking for or needs in order to make a comprehensive decision. And you and I both know they're not just going to purchase a product and then hope it works. And they also don't have a year to test it out to determine whether or not they're going to buy it. So if they were to, I'm speaking from what healthcare providers have actually asked me about UV light, and there is no real source for them to go to. It almost feels like you have to be an expert in that to truly understand what the capabilities are, and then to truly help you in making a decision or ask informed questions because they don't know what they don't know. And so a lot of times what'll happen is someone will purchase something that really isn't going to meet their needs because they have a good salesperson, right? Um, so I'll go back to my same question. Is your organization one that could reach out to be able to get potentially a list of questions or some guidance around what are the critical things you need to know, understanding that they need to understand and know their environments as well. And then there's staff capabilities because, I have one director of infection prevention say, "Hey, we bought one of those UV lights and our C. diff rates went down and everything." And she said, "All of a sudden I noticed them going back up again." And I said, "Well, that's really interesting. What was it, bulbs?" And she says, "No, they weren't taking the device out of the closet to use it."
Right, right, right. It wasn't an ongoing habituated habit with scheduling and understanding. So that let's sort of break your question down a little bit.
Okay.
UV for Good is developing the capability of really assisting exactly as our mission says. And I think that's going to develop this year because, like yourself, we recognize this gap in sort of there's the microbiology lab, there's the uh, industry that's marketing and selling, and then there's a history of the user base. So maybe my one advice is that if you've gotten to the point recognizing the capability of UV light, we want to get this job done. We can train folks to do this, right? And that's good. Then you said, which is the best emitter? I think one of my first questions I would sort of ask a salesperson is like testimonials. Can we talk to all the people that use your device and sort of get the best of it and sort of the gotchas of it and how the workarounds, right? Can we really get your past users to inform us how it worked? And then sort of the veracity of their claims can be brought to the forefront, right? Like, yes, please call these users. They're more than welcome to talk about their experience. They've talked in public about their experience. They'll in a sense be the guidance on how to get the best out of this capability. Maybe that's the starting point. That's the first best question.
Awesome. Okay, so let's talk briefly about regulatory agencies. So one of the questions that has been brought up is who regulates UV light?
Yeah, that's a really good question. And it's still an unanswered question. The EPA certifies that such technology can be applied to surfaces, but certification isn't regulation. The EPA goes a little further when the UV light is applied to water treatment, right? It has guidance to get the most out of your UV systems to safeguard water. But it backs off a little bit and it doesn't provide such guidance for hospital services. It just certifies that this UV light, in a sense, is a capability that can reduce pathogens on surfaces. Enter the FDA in the last year or two. They recognize, I think, the theme of our whole conversation, that it's a little bit uncertain about all the different types of lamps and all the different types of configurations and all the different ways UV light can be made capable and be productive in a hospital environment. And they're, I think, trying to come to grips with this, right? And they've held meetings, but they're still not really truly approving technology. A couple of the suppliers, took the initiative to try to drive some approval, and they got a degree of approval, but it's not applicable across the industry. It was really for their devices. And, one can make the case, is that a marketing ploy, or is that sort of trying to all, the tide raises all ships, right? And I think that's still to be determined. The in the UK, they took a little more rigor and they actually uh, stipulated sort of microbiology that such devices would have to meet, right? So that's a big step because that's still lab based, but at least gives you a starting point so you can sit there and make a decision and go, at least this has this capability, and these are the pathogens of interest, and this emitter has at least gone through that. And then I now have to really go through, as I said, the day-to-day practice of seeing that's repeatable. So I believe that the UK is a little ahead of the US, and I actually foresee the UK adding the monitoring and assurance part, because once you sort of stipulate you can get something done productively, then let's see if it got done productively, right? So that's, I think, where we're at. Um, I won't really comment on whether or not that's a useful decision-making data point in the purchasing, but I would say these are the type of questions to ask. Like, why isn't it regulation? What would be regulated? Am I not getting something, or am getting something that's been at least tested, right, to some degree of standard? And these are good questions, right? Because eventually the job is to reduce the pathogen load and do it quickly and make sure, as we've talked about, the user base takes ownership of it, which is good, right? Because doing a job well gives you pride, and you do other jobs well, then your peers do jobs better, right? It's positive reinforcement.
Mhm. It's really interesting because we've got several things working against us and for us here, right? We know it works. We can't see microbes, so we don't know how it works, or we don't know that it's working because the room now looks clean, right? How do UV manufacturers test to validate that their devices are killing specific pathogens? So, how do they provide support and maybe education around how to know whether or not it's truly working?
Right. So uh, the starting point is all lab based because UV has been capable for 70 years, right? And can you demonstrate some capability in very controlled environments? That's a good starting point, right? And I believe the UV industry does that fairly well. But even that has sort of margin of uncertainty because it's microbiology, right? It's not perfectly known every time, totally repeatable. It sort of has little error bars, but that's okay. Those can be lived with because we're talking about reduction. We're not talking about sterilization. Once you have a candidate, let's say, of a emitter, and you've gone through some rigorous sort of assessment and vetting process, there's sort of this on-site validation moment where and I know of one supplier that does this very well. They'll actually look at different configurations of their emitters, and they'll look at ways of doing some optical testing, and they'll look at, like you said, line of sight, is it getting somewhere that's of value? And then the real question is it missing something that should have been of value? Let's make an adjustment, right? Because you don't want to miss spots that are important, right? And then they may do some microbiology in the room, and they may not, or they may use, in a sense, a surrogate, a detector that says the light made it to this point. You thought you had C. diff at these points on the bed rail in the bathroom. Therefore, if there's significant amount of light being detected, and this would relate to this degree of reduction, most likely when you do this in practice, you'll repeat this, right? You'll get some degree of reduction with confidence. And I think that's where it stops, because it becomes very costly and very timely to go down the path of even more rigor. But that's the decision of the hospital. How rigorous does it want to be? But these, again, it comes back to some education, which we're hopefully providing today, a little bit of training, and asking the right questions. And I'm a big proponent of asking hard questions, right? And you get hopefully really, really thoughtful answers with evidence.
So, it's always fascinating. Cleaning and disinfection in healthcare is, the challenge because you can't see what you're trying to destroy and clean. And I know that this is such an interesting topic because there's a lot of unknowns about this as well. So Typically, you can't have a patient in the room when you are using UV light, although there are some types of UV that are actually built into the room, the high level, the upper air UV lights. And so tell me a little bit about why that's different. Why is the upper air, why can we put them in the ceiling and have them work, as opposed to, putting the light on for 10 minutes a day in the room with the patient in it?
This is a really fascinating question because it gets to what does the job best, right? As part of your question and answer. Is it better to, in a sense, treat the air, and the air is what circulates pathogens that settle? Is that a layer that's important versus treating the surfaces that may be touch to touch contaminated, right? Um, the air in a hospital, more likely than not, is treated by ultraviolet light, but not in the room. It's treated in the big air handlers on the roof, right? The whole ductwork probably has various degrees of pathogen reduction capabilities. And that's how they treat the air circulating through the whole hospital. But within a certain room, you sort of have a choice. Do you want to do a little bit of air circulating well above the patient, right? And that's been proven to be effective and safe. And there's a whole organization called ASHRA. It's like the HVAC Mechanical Engineering Trade Organization that has gone down the path and proven that you can reduce pathogens that are floating in the air, yet create a safe environment for people in the room. Then there's other technologies that are burgeoning that says you don't have to limit yourself to a volume of air above the patient. You can actually treat the volume of air in the room. And that's a little less proven. That still has the burden of really showing that it has utility and it's cost effective and it's safe for the occupants and it's safe for the surfaces it's continuously exposing. These are all good choices. They maybe are all layered choices, but then you're asking for a lot of implementation costs, right? And does the layer of choices really add up to lots of protection and reduction? Or are you satisfied with our job at hand is to do this? And if we find the right mobile emitter or mobile emitter with satellite units, it gets the job done pretty well and pretty repeatability. Although it's manual, it takes the ability for the workers to be educated, trained, and take responsibility and ownership. So I'm not quite sure they're at odds. I think everything is sort of multimodality, but if you're sort of limited to one choice, you probably still have to stick with let's just work on the surfaces in a short time between patient occupancy.
And then one quick final question, because we're running out of time. And there's an issue of UV light and how it reacts or its durability. So what it's doing is some plastics are being damaged. Typically, you can't see the damage immediately, but things will break due to the UV light. Tell me your thoughts about that. Are they
Right.
damaged
So
or
undoubtedly, ultraviolet light can uh, lessen the integrity of plastics and other materials. That's understood. The industry and the academics have done work trying to show sort of what's the point where something starts to become undermined, right, or discolored, or loses its material integrity. And I don't think it's done a complete job, but I think it's done enough to show that in most use scenarios that they've seen for 10 years, that more likely or not, you see how everything has a slight caveat on it, you're probably operating in a fairly good Goldilocks zone where you're getting some reduction of pathogens without undermining surfaces. But the whole point is to have it consistent, to get the best use of it, to deal with the worst case pathogens. So that's probably another question that needs to be asked of the providers. I call it the Goldilocks zone. What's the best sort of middle ground between getting what you want out of your investment reduction, doing it in a timely manner, but making sure that all other aspects of the room aren't being undermined, right? Because if you, in a sense, uh, illuminate certain types of materials, it may not only be the material that gets undermined, but it may release like a VOC or something. And that sort of undermines everything else because now you've done an IAQ problem. So these are good questions to ask. More likely or not, you're probably doing okay, right, as a current user of UV, but I think it needs a little more, you have to peel back the onion a little bit and make sure that you're getting to this Goldilocks zone. I think that's a really fair type of question to ask of the supply community.
Perfect. Well, Peter, I want to thank you for joining us today. And Peter's organization is UV for Good. Thank you again. And I really look forward to bringing you back again in the future as we continue this discussion around UV disinfection. So thanks for coming.
Thank you for hosting the talk. I hope I informed the audience, and we're always available for the ISSA to promulgate education and training and best use practices. Thank you again.
The ISSA healthcare platform has launched. On the website, you will find all kinds of things, blogs, resources, training information, workshops. Stop by our website. It's issa.com/healthcare.